I'm Dr. Ellis, an internal medicine physician with over 45 years treating adults as they age. I've seen thousands of patients, and one truth becomes clearer every day. As we get older, our bodies speak a quieter language, subtle, easy to ignore, but often desperately important. People over 60 tend to dismiss minor injuries. It's just a scrape, or it doesn't even hurt, they say. But in my decades of practice, I've watched these small, dismissed injuries quietly grow into life-changing, sometimes life-threatening complications. Today, I need you to hear me clearly. After 60, there is no such thing as a truly minor injury. Your body has changed, silently becoming more fragile, less resilient. Every bruise, cut, or ache must be treated with careful attention and respect. Let me show you exactly why. Section 1. Skin tears and infections. Mrs. Thompson, 71, gently bumped her arm against her garden gate. A small scrape, barely bleeding. She covered it with a bandage and forgot about it. Days later, she developed redness and swelling, eventually calling my office when fever set in. That tiny scrape became cellulitis, a dangerous infection spreading rapidly through her tissues. As we age, skin becomes thinner, losing protective layers and elasticity. Even minor skin tears easily become entry points for dangerous bacteria. Older adults' immune systems also respond slowly, giving infections precious time to spread unnoticed. Mrs. Thompson nearly lost her arm, not because of carelessness, but because she underestimated her body's quiet vulnerability. Older adults' immune systems also respond slowly, giving infections precious time to spread unnoticed. Mrs. Thompson nearly lost her arm, not because of carelessness, but because she underestimated her body's quiet vulnerability. If you've ever dismissed a small wound as no big deal, think again. Your skin may not heal the way it used to, and the consequences can be serious. If this story reminded you of someone, or even yourself, share your thoughts in the comments. And if you care about healthy aging, don't forget to follow for more quiet truths your body wants you to hear. Section 2. Slow Wound Healing. Mr. Andrade, 68, nicked himself shaving. He ignored it, assuming it would heal in days like it always had. Instead, it remained raw, stubbornly open for weeks. He dabbed on ointment and bandaged it, but it kept bleeding, weeping. Quietly infected beneath the surface, the wound worsened until he finally came to see me, tired and confused. Tests revealed undiagnosed diabetes, silently delaying his healing process. His blood sugar levels were quietly wreaking havoc on circulation and immune function. What seemed like a small annoyance was actually his body waving a warning flag he couldn't see until it was nearly too late. Older bodies heal slower. Reduced blood flow, declining collagen, and chronic conditions like diabetes make even small cuts take weeks instead of days to recover. This delay opens the door to serious complications, chronic infections, ulceration, and deeper tissue damage. Mr. Andrade's tiny cut was a signal. A red flag, not a paper cut. Slow healing isn't a minor inconvenience, it's your body's subtle cry for help. Listen carefully, or the quiet dangers lurking beneath the surface will speak louder through crisis, through pain, through loss. Section 3. Reduced pain sensitivity. Eleanor, 75, twisted her ankle while reaching for a can of soup at the grocery store. She felt mild discomfort but no sharp pain. "It'll go away," she told herself. She limped slightly but continued walking, cleaning, and shopping. Days passed. Her foot swelled, her gait shifted, but she ignored it until one morning she couldn't stand without wincing. An X-ray showed torn ligaments and a hairline fracture damage made worse by days of strain. Aging nerve endings dull pain perception. What once felt sharp now feels muted. Injuries that would have screamed in her 40s now whispered in her 70s. That whisper let a manageable sprain become a long, painful recovery. Pain isn't just discomfort, it's communication. The body warns us when something's wrong, but after 60, the volume gets turned down. Subtle discomfort often conceals real trauma. By the time the pain becomes loud, the injury may already be severe, healing time longer, and independence more at risk. Have you ever ignored minor pain because it didn't seem bad enough? Your body may not scream anymore, but it still speaks. Share your experience in the comments, and if this message resonated with you, follow us for more insights on aging wisely and safely. Section 4, Bone Fragility and Hidden Fractures. Arthur, 79, slipped gently while getting out of bed. No loud crash, no sharp cry. He landed on his hip, flinched, then sat up slowly. "Just a bruise," he said. The next morning, the ache returned, dull but persistent. He took some acetaminophen and pushed through his day. After all, that's what toughness looked like, right? But by the third week, his walk had changed. His steps shortened, his body leaned. "Old age," he chuckled to himself. When he finally saw me, his hip was inflamed and he was wincing with every breath. An X-ray revealed a hairline fracture worsened from continued pressure and activity. He had been walking on a broken hip for nearly a month. At 40, the same fall might have left only a bruise. But after 60, bone density declines rapidly, osteopenia and osteoporosis creep in, often undiagnosed. The cushioning of youth vanishes. Minor slips become structural damage. What made it worse? He didn't feel much pain. That's the danger. The fracture whispered, not screamed. And Arthur, thinking he was being resilient, had made it worse. Stubbornness doesn't protect bones, it endangers them. Vitamin D deficiency, lack of resistance training, years of gradual demineralization, all silent contributors. A simple stumble became a months-long rehab journey, stealing mobility, independence, and confidence. Arthur's embarrassment nearly cost him more than his pride. Pain that lingers after a fall, even if faint, is never trivial after 60. Take the X-ray. Get the scan. Listen to the whisper before it becomes a scream. Section 5. Medication masking symptoms. Mrs. Gonzalez, 72, took her arthritis medication like clockwork and SAIDs in the morning, muscle relaxants at night. When she slipped in the kitchen, she landed hard on her side. But surprisingly, she felt almost no pain, no bruising, no sharp twinge. Just a dull soreness she thought would fade. So she carried on, thinking she'd gotten lucky. By the third day, she noticed something strange. She couldn't breathe deeply. Laughing hurt. Bending over sent a tight pressure across her ribs. Still, she hesitated to call anyone. "It's just soreness," she whispered. But something inside told her to get checked. When she arrived at my clinic, her breathing was shallow and guarded. A chest X-ray revealed the truth: a cracked rib and a partially collapsed lung. The fall had caused real internal trauma, but the medication she relied on had dulled the signals. Her painkillers and anti-inflammatories had masked the warning signs meant to alert her. Many seniors are on medications that silence their body's natural alarm system. After 60, common drugs in SAIDs, corticosteroids, even mild opioids dull pain receptors, reduce inflammation, and delay immune response. What once would have felt like agony now passes quietly, dangerously unnoticed. And let's not forget the psychological factor. If it doesn't hurt, it must be fine. But pain is your body's honest voice. Suppress it completely, and you risk missing the most important messages it has to send. Have you ever pushed through strange symptoms while on medication? That silence might not mean healing. It could mean hiding. Share this with someone on daily meds. And if you're here to age smarter, not just longer, follow us. Your body still speaks. Learn to listen, especially when it's quiet. Section 6. Delayed immune response. Frank, 74, was an avid outdoorsman. One afternoon, while cleaning fish, he nicked his hand with a small fillet knife. It barely bled. "Just a scratch," he muttered, rinsing it under water and moving on. But over the next few days, fatigue set in. His joints ached. He felt chilled, slightly feverish, but still, he waited. By the time he came to see me, his hand was swollen and red. His temperature had spiked. We ran blood tests. The verdict: early sepsis. That tiny cut had allowed bacteria into his bloodstream, and his aging immune system hadn't raised the alarm fast enough to stop it. As we age, our immune response slows down not just in fighting off infections, but in recognizing them in the first place. The signs of infection, fever, swelling, redness appear more slowly, and sometimes not at all until the threat has grown silently dangerous. In Frank's case, the wound looked benign, but his white blood cells had reacted sluggishly. His body failed to mount a defense in time, giving the bacteria space to multiply. What would have been a minor issue at 40 became a hospital stay at 74. Even small injuries, scrapes, blisters, or cuts deserve close monitoring after 60. Delayed immune response means infections progress further before symptoms are noticed. By the time you feel sick, the danger may already be severe. Frank was lucky. Antibiotics worked. But if he'd waited another day, the infection might have overwhelmed his system. He told me later, "I thought I was being tough. I didn't know I was being reckless." Final reflection: Dr. Ellis's urgent message. Over the decades, I've treated thousands of patients. Many of them had one thing in common. They underestimated the quiet warnings their bodies gave. They believed being strong meant pushing through the pain, dismissing cuts, hiding fatigue. But in aging, strength isn't in silence, it's in vigilance. After 60, your body changes. It doesn't scream when something's wrong, it whispers. A bruise becomes a bleed. A stumble becomes a fracture. A scratch becomes a bloodstream infection. None of these changes happen overnight, but they happen. And when you ignore them, they win. The stories I've shared aren't meant to scare you, they're meant to protect you. They're meant to teach you what I've learned the hard way. After 60, there's no such thing as just a little thing. Every signal matters. So here's what I ask: respect the whisper. Treat every cut, ache, and wobble as if it matters, because it does. Don't let pride, habit, or fear keep you from seeking help. A small moment of attention can prevent a lifetime of regret. Your body wants to protect you. It still does. But it needs you to listen more closely now. If you've ignored something lately, any small change, this is your sign. Take it seriously. And if you know someone else who needs this reminder, pass it on. Let's grow older with wisdom, not risk.